Cancer can cause your body to change in many ways: a fever, chills, fatigue, and weakness.
An unintended loss of weight, swollen lymph nodes, or an enlarged spleen. These specific symptoms belong to leukemia, a common type of blood cancer.
However, the treatment to fight cancers such as leukemia require treatments such as chemotherapy.
One of the common side effects of these rigorous treatments is the loss of hair, but you can always count on us to solve this problem.
Chemotherapy can cause a feeling of dread and a sense of being different. However, here in our store, Hats for Healing, we help cancer patients feel a sense of normalcy despite the challenges they face.
Our hats are made with utmost care and help empower individuals to smile, be fashionable, and retain confidence even through the long battle they have fought. We also customize wigs so our customers have the perfect look.
In addition, we specialize in silk pillowcases and other hair products to prevent scalp irritation, a common side effect of hair loss.
Hats for Healing, founded by Abhinav, Shivy, Anya, and Miley, here to bring you an infomercial on leukemia.
Leukemia is a collection of cancers that affects the blood. When leukemia occurs, there is a rapid growth of stem cells in the bone marrow. Blood cells start as stem cells and can develop to be specialized. These stem cells can grow into myeloid or lymphoid cells. Myeloid cells can develop into red blood cells, platelets, and certain white blood cells. However, the lymphoid cells can develop into other white blood cells and lymphocytes. Stem cells grow at an out-of-control pace during leukemia. They can outnumber the red blood cells, white blood cells, and platelets, which is abnormal. These cells aren't useful and prevent the development of normal blood cells. Thus, the red blood cells won't be able to do their purpose of carrying oxygen to the tissues in the body, and white blood cells cannot fight off foreign substances such as viruses. Since the platelets are affected by leukemia, they won't be able to serve their purpose of clotting wounds as well. It is important to note that leukemia doesn't form in masses of cells, such as tumors, but rather is an excess of stem cells. There are 4 types of leukemia. In myelogenous leukemia, cancer develops from the myeloid cells. Meanwhile, in lymphocytic leukemia, the cancer develops from lymphoid cells. Leukemia can either be chronic or acute. The cells divide much more quickly and become life-threatening in acute leukemia compared to slower-paced chronic leukemia.
There are a combination of environmental and health factors that can cause leukemia, along with also being inherited. The first risk factor is genetic conditions linked to leukemia, such as Down syndrome and trisomy 13, caused by mutations in the DNA. Second factor is certain viruses that may increase the risk for leukemia. Examples are HTLV and HIV. The risk of getting leukemia may be greater if one family member has been diagnosed with leukemia. This is most common in siblings and often occurs in identical twins. The fourth risk is environmental factors linked to leukemia. Examples are radiation, chemicals, smoking, and chemotherapy drugs. Living near power lines or a nuclear power plant could also raise the risk. The final and fifth risk is blood disorders, which can increase the risk of developing AML. Examples are MDS. And scientists don't exactly know what causes it. There is no actual way to prevent leukemia. However, the chance of getting it can be lowered by avoiding certain triggers, limiting exposure to cigarette smoke, chemicals, pesticides, and radiation, and maintaining a healthy diet and regular exercise would help. There is no cure for leukemia. However, long-term remission or no sign of cancer with or without treatment can be achieved. This could last a few weeks or many years. The cancer could never return.
Leukemia can be diagnosed in many different ways. If a person feels as if they fit the symptoms of the disease, such as easy bruising and bleeding, it would be optimal to visit a doctor to partake in any of the following procedures. One method to diagnose leukemia is a physical exam and health history checkup. This is an exam of the body to check for signs of leukemia. A history of the patient's health habits and past illnesses and treatments will also be taken. This is because previous cancer treatments have contributed to leukemia in the past. Another method of diagnosing is having a complete blood count in which a sample of blood is drawn and checked for the number and type of red blood cells, white blood cells, and platelets are in the blood. The amount of hemoglobin in the blood is also accounted for to make sure the patient's blood is of regular proportions. Furthermore, a bone marrow biopsy is an effective way to test for leukemia. This procedure includes the removal of bone marrow blood and a small piece of bone by inserting the needle in the hip bone or breastbone. A pathologist views it under a microscope to look for abnormal cells. Many different types of tests can be run to analyze a bone marrow biopsy. One of these tests is a cytogenetic analysis where chromosomes of cells in a sample of blood or bone marrow are counted and checked for any changes such as broken, missing, rearranged, or extra chromosomes which cause mutations leading to leukemia. Treatments for leukemia tend to slightly differ based on the type of leukemia being treated. For that reason, we will focus specifically on the treatment of chronic myelogenous leukemia, also known as CML. To review, CML occurs when the bone marrow produces too many white blood cells. After the type of leukemia is diagnosed, tests similar to the ones previously mentioned are conducted to determine how far the cancer has spread. CML is split into 3 phases. The chronic phase is when 10 to 15% of the cells in the blood are blast cells. The accelerated phase is when 15 to 29% of the cells are blast cells, and the blastic phase is when 30% or more of the cells are blast cells. Chemotherapy is a common and effective cancer treatment using anti-cancer drugs that are injected into a vein or taken by mouth. For example, the chemo drug hydroxyurea is taken as a pill and acts specifically during the S phase of the cell cycle by inhibiting the enzyme ribonucleoside diphosphate reductase, thereby stopping the conversion of ribonucleotides to deoxyribonucleotides and halting DNA synthesis. These drugs enter the bloodstream and reach all areas of the body, making this type of treatment useful for cancers that spread throughout the body, such as CML. Any drug used to treat cancer can be considered chemo as long as it is a cytotoxic drug that mainly kills cells that are growing and dividing rapidly, such as hair. In some cases, a treatment requiring high doses of chemotherapy is given to kill cancer cells. Healthy cells are also destroyed by this cancer treatment, so a stem cell transplant, which is a treatment to replace healthy blood-forming cells that are lost, takes place. Stem cells are removed from the blood or bone marrow of a donor and are stored. After the patient completes chemotherapy, the stored stem cells are entered into the patient's bloodstream through an infusion. Targeted therapy is a type of treatment similar to chemo, but targets specific cancer cells, causing less damage to normal cells. CML cells contain an abnormal gene which codes for the protein BCR-ABL, which causes CML cells to grow and divide out of control. BCR-ABL is a type of protein known as tyrosine kinase. Drugs known as tyrosine kinase inhibitors that target BCR-ABL are the standard treatment for CML, such as imatinib. The way targeted therapy works changes based on the type of TKI. Angiogenesis inhibitors block the formation of new blood vessels that feed and nourish the cancer cells. Monoclonal antibodies deliver molecules into or onto the cancer cell to kill it. Proteasome inhibitors disrupt normal cell function so the cancer cells die. Signal transduction inhibitors disrupt cell signals so that they can change the actions of the cancer cell. Since leukemia doesn't form as a tumor, a mastectomy isn't an applicable treatment. Instead, chemotherapy and targeted therapy are most commonly used.
Do you want to know if you're a high-risk patient? At Hats for Healing, we are here to inform you on everything you need to know about how leukemia affects different patients. All 4 types of leukemia can affect any patient. Acute lymphocytic leukemia is the most common type of leukemia in children, teens, and young adults. Acute myelogenous leukemia is the most common type of acute leukemia in adults. However, the most common chronic leukemia in adults over the age of 65 is chronic myelogenous leukemia. Leukemia is the 10th most common cancer in the U.S., accounting for 3.2% of all new cancer cases. The rate of new cases of leukemia was 14 people per 100,000 people per year. The death rate was 6 out of 100,000 people per year. Recently, articles come out explaining how there's been a new treatment option for people suffering from acute myelogenous leukemia. On July 20th, the agency approved Cornizip combined with chemotherapy as part of the initial treatment for people with AML that has a specific change in the gene called FLT3. The FDA's decision to make Cornizip the second FLT-targeted drug approved as an initial or first-line treatment for people with AML. This is a major step that will reduce the death rate of patients who suffer with AML. For more information about this topic, feel free to read the following article.
Hello, my name is Sarah Lewis. I was diagnosed with acute myelogenous leukemia at the age of 27. Hats for Healing has helped with my confidence in it. I was unsatisfied with my appearance when I started losing my hair due to my chemotherapy. At Hats for Healing, I was able to purchase a quality wig for an affordable price.
My name is John Green, and I was diagnosed with chronic myelogenous leukemia at the age of 68. At Hats for Healing, I was able to buy a variety of hats. This brought me joy, and I even got to customize some of the hats myself.
Hi, my name is Stacey Williams, and I was 14 when I was diagnosed with chronic lymphocytic leukemia. When I first started my targeted therapy, I was devastated at the thought of losing my hair. However, Hats for Healing supported me along the journey to feel confident with my new hairstyle.
Hi, I am Drew Smith, and I was diagnosed with acute lymphocytic leukemia 5 years ago at the age of 8. I didn't quite understand what was going on at the time, but I knew that my treatments were giving me scalp irritation during hair loss. I'm extremely grateful for Hats for Healing's silk pillowcases, which were the only thing that let me sleep through the night comfortably.
Hats for Healing was founded on Lower Hat Boulevard and James, in locations all over the United States. Please call 1-800-FAKE-HAIR for more information about this business. Thank you.
I'm wearing a wig.
I was diagnosed with acute leukemia at the age of 20.
And I was diagnosed with chronic
started my targeted therapy.
Hi, I am Jim Smith, and I was diagnosed with acute lymphotic
Chronic lymphocytic leukemia. When I was first... Oh my god, I'm so...